We are live.
All right, we're live. Good morning, good morning, good morning.
Good morning.
As y'all come into the room, please give a shout out. Please say hello. Please let us know that you're here.
Yes, come on in the room.
She had a different tune today, y'all. Y'all notice that, right?
In the room. Yes.
Yeah, she had a different rhythm going on. That was today. Hallelujah.
I'm super excited about today.
Oh, yes, this is going to be an awesome day. An awesome day.
Awesome day.
Awesome day, y'all. Just to give you an idea, of course, we are pastors Antoine and Ramona Hallman of Faith Works Ministries. Yes. We are a Christian, non-denominational, Bible-teaching church. We believe that the written word of God is true. We believe in the eternal Godhead of God the Father, God the Son, God the Holy Spirit. And we believe and know that Jesus Christ is Lord. Amen. Amen. Amen.
Amen.
And y'all, again, today we have a special. And if you notice, we got different mugs today, y'all. Of course, I got my Man of God mug.
And I have my Enjoy Every Moment mug. We're about to enjoy some things on today.
Yes, yes. And of course, like those other mugs, they're like coffee pots, but these are literally like fish tanks. You know,
we always be talking about these mugs that I be getting. So we're gonna have a great time today, y'all, because we feed everyone. We love to feed you spiritually with the word.
Mm-hmm.
We love to feed people physically with the different things we do around the community.
Yes.
And we love to feed people mentally as well.
Yes, and that is the God-given purpose of this ministry is prayer and community outreach. Those are our two God-given purposes. And again, today, y'all, we have a very, very special coffee and tea today. We have members of the Sauk County Public Health Team joining us to give us some true, bare facts about the COVID-19 virus as well as the vaccination process. And of course, please tell them the purpose of this today.
So, of course, when we look at this, so good morning to everyone that's coming in and speaking to us. Betty, how you doing? Minister Tanisha.
Minister T.
Mama, hey, y'all.
Hey,
y'all come in, keep speaking. So today, what we're really looking at is when we're talking about this, we're not saying, oh, go out and get the vaccination. And we're not saying, don't go get the vaccination. What we're saying is we want you to have the facts. We want you to be able to have the information because without that information, without that knowledge, people will perish. And so you need to be able to make an intelligent decision for yourself and for your family, what is going to be best for you.
Absolutely. And again, it's like we're not trying to sway you one way or the other, but we are here to give you facts. We're here to give you truth.
Yeah.
And that's what we're going to do. We're going to give you the truth. And so let's start. Let's introduce the team.
And we're going to bring the team in. And then, of course, this is for questions. So we did receive some questions that we have, but we also want you to be able to type in your questions as well.
Yes, please ask questions, and also please SHARE. I can't say it anymore, so spread the word.
Spread the word.
And there's a little button in your on your Facebook there. Got a little arrow that says SHARE. Push it.
So yes, everyone. So y'all know how we just love technology, and so we are going to see how this all goes. And hey, Latrice. You jumped in too. I see everybody's jumping in.
And yes, the members of the team are just going to introduce themselves by name and tell us what they do.
Okay, here we go.
Good morning. Thank you so much for having me to your coffee and tea this morning. My name is Jody Molitor. I am the Health Educator and Emergency Preparedness Coordinator for Sauk County Public Health.
Thank you, Jody.
Hi, good morning, everyone. My name is Sarah Jesse. I work to improve community health in Sauk County. I have my dream job because I get to work every day to make Sauk County the healthiest place possible for everyone.
Hallelujah. Thank you. Thank you, Sarah.
Thank you.
Good morning. Thanks for having us today. My name is Bessie Phelan. I am the nursing manager for the Sauk County Health Department and the Operations Section Chief for our COVID response. And I'm happy to be here today. Thank you.
Thank you, Jesse. And we have one more member of the team that's going to be joining us a little later. She's actually getting some new furniture. I'm jealous. So right away, y'all, we just want to dive right into this thing here. Yeah. Jody, can I please ask you the first question here? We want to please again ask questions. Put your questions in the comment section, and we thank y'all for those questions that came beforehand. But Jesse, this question is for you. Jody, I'm sorry. Okay. Jody, what exactly is COVID-19?
Sure. So COVID-19 is a new strain of a very known virus in the coronavirus family. Some symptoms that you might have if you get COVID-19, severe symptoms could be cough, shortness of breath, fever, chills, loss of smell and taste. That's a very common one that really help people to know that they most likely might have COVID. But not everyone with COVID has these symptoms. That's a very common thing that we're seeing are asymptomatic people in our community that are still able to spread the virus. And many people have very mild symptoms, no fever. So it's a really important thing that we want you to know that you can still transmit the virus, even if you have very mild or no symptoms. Another very different fact with COVID-19 is that symptoms can appear in as little as 2 days, but also up to 14 days after you've had contact with somebody with COVID. So that's really one of the hard things that we're trying to impress upon people is that quarantining and isolating is very, very important because you can really transmit that virus for a long time.
Well, thank you. Thank you for expounding on that question. I'm going to ask you another question, please, Jody. How is COVID-19 transmitted and contracted?
Sure. So it spreads from person to person between people who are in close contact with one another, usually within about 6 feet. It spreads mostly through droplets that are generated when an infected person coughs, when they sneeze, or even speaking. So these droplets can land into the mouths and noses of people who are nearby, or it can also be inhaled into your lungs. So that's why it's really important, the social distancing that we're promoting, to keep yourself far enough away from people that might be contagious. So you also, though, can become infected by touching a contaminated surface. And then, you touch your eyes, your nose, your mouth, just like in the common cold in that effect. It also, like I said, can be spread before you even start showing symptoms and by people who never develop symptoms.
And thanks for that. So just so we're clear, you can't get it from a bug bite.
No, you cannot get this from a bug bite.
You can't get it from 5G wiring.
No, you cannot.
All right. Just so we hear that, okay.
So I know, because I mean, it's like, so is it like traveling by the insects all over? So it is a great question to ask. And so I know we have other questions here. And so, Jody, when it comes to, I really want to know is, can somebody catch this more than, can they catch it more than once? Or is it like, one time you get it and then it's a done deal? Like, talk to us about that, please.
So unfortunately, this is kind of one of those iffy answers. We have had cases of people that have become reinfected after they have already recovered. And part of this is we don't know how long your immunity lasts once you have recovered from COVID. Right now, we've got immunity at 90 days is what they're saying, but COVID is so new that, recommendations just keep changing. So yes, it can happen. You can become reinfected after becoming well again, but it is not a common thing.
Okay, and then to kind of follow up with that one, with that question, how is COVID different from the flu? I mean, can a person have COVID and the flu? Can they coexist at the same time?
Sure. So the influenza and COVID-19 are both contagious respiratory illnesses, but they are caused by completely different viruses. So COVID-19 is caused by an infection with this new coronavirus, and the flu is caused by an infection with influenza viruses. A thing to note is that COVID-19 seems to spread much more easily than the flu, and it causes serious illnesses in some people. It can also take longer for people to show symptoms, and they can be contagious longer, as we've talked about. But because a lot of these symptoms are similar to each other with the flu and COVID-19, it can be really hard to just tell the difference on your own. Do I have the flu? Do I have COVID-19? And that's why we are stressing how important it is for people to get tested, because we really need to isolate or quarantine you if you are positive with COVID so that you cannot spread it to more people. So health experts, though, are still studying how common it is to have both at the same time. You know, again, this is so new that we just don't have that much research on that.
Understood. Thank you for that. Yes.
So just for those, because we see that we have more people coming in, and so this is a special edition of our coffee and tea time, and so we are dispelling the myths when it comes to COVID-19, and then also being able to talk about the vaccination process.
Yes.
And so again, we have the great team with us from Sauk
County Public Health Department.
Yes.
Yes, and then again, we're just getting these questions, getting these facts, and getting these truths.
Yes.
And of course, I'm just going to keep going with the questions here, y'all. Sarah, can I please ask you this question? Now,
Absolutely.
Notwithstanding economic status or access to medical care, is there any race more susceptible or predisposed to COVID-19?
What a great question. Thank you for that. You know, the virus doesn't target people from specific ethnicities or racial backgrounds at all. Like, you can't tell if someone is at higher risk for getting COVID, for spreading COVID, by how they look. And that includes people of all backgrounds. I know initially, you know, when this virus hit, people who look Chinese were really treated differently, and that's wrong, right? Anyone can get this. But we do know that some racial and ethnic minority groups are being disproportionately affected by COVID-19. And that's what we're showing up here on the slide, that really inequality has worsened during this pandemic. So unfortunately, in Sauk County, we find with our statistics that Latino and Native American residents are overrepresented in coronavirus cases and hospitalization. So what does this look like? In terms of cases, Latinos and Native Americans have double the expected COVID-19 case rate. So in Sauk County, 5% of our population is Latino, but 10% of our coronavirus cases are Latinos. Same with Native Americans. 1% of our population are Native American, but 2% of our confirmed cases. So again, double. We don't find this disparity with our African American population here in Sauk County. It's 1% of our population and 1% of confirmed cases. So interestingly, we're not seeing that.
Okay.
We also see increased rates of hospitalizations due to COVID-19 for Latinos and Native Americans again. Latinos, again, are 5% of our population, but 8% of our COVID hospitalizations. They are just 3% of deaths, so actually fewer deaths than what we would expect. This could be because in Sauk County, we don't have a whole lot of Latino residents who are older, like over age 65. For Native Americans, we see, again, they are 1% of our population, but 5% of our COVID-19 hospitalizations, and they're nearly 3% of our deaths. So a higher percentage there as well than what we would expect. And African Americans, again, we don't see that. We see 1% of our population, 1% of our hospitalizations, and so far 0% of the people who have died have been African American in our community. And I know your question, Pastor, was, notwithstanding racial, differences in economics, but I have to speak to that. It's a passion of mine. This is my job. Yes. For health equity, that we feel that these disparities that you're seeing up on the screen, they are due to, social and economic inequality that we see here in Sauk County. And I'm talking here about discrimination. I'm talking about healthcare access, occupation, housing. All of these play a role in who gets COVID and who gets a bad case of COVID. Historically, racism has played a big role in preventing, and I feel still prevents people of color from having fair opportunities for economic, physical, and emotional health. And I can break that down more. I don't want to bore everybody or go into this too deeply, because I know your question was not about this, but I just have to say, discrimination still, yeah, okay, I can go down that rabbit hole. Unfortunately, discrimination does exist in systems that are meant to protect people's health and well-being, so our systems of healthcare, housing, education, criminal justice, finance, this can lead to toxic stress, and it really can shape all of this health in the end. We know that stress causes health problems for
Yes.
some more at risk. And then there's healthcare access, which of course at Public Health, we really feel very strongly that everyone should have access to high quality healthcare. And that's not always true. You know, there's barriers like not having insurance, not having the transportation to get to healthcare, especially in our rural community here. You know, not having childcare, perhaps having a job where you can't take off time, having, some kind of punishment for that, you know. There could be communication and language barriers for our Latino population, cultural differences between providers and patients. It kind of goes on and on here.
Yes.
You know, like, so to explain these differences further, like some people from racial and ethnic minority backgrounds might be more heavily in work that's considered essential, you know, that's interacting a lot with the public, things like farms and, you know, interacting with other closely to factories, grocery stores, restaurants. And it's hard to take off work when you have a lower paying job like this, because you might not be privileged to have, you know, paid days off from work.
Exactly. So Sarah, you hit it on the head, because that question was kind of like a double-edged question, because I did want to separate it though. I did want to just say, so a person's DNA, a person's race won't affect how the virus necessarily is going to affect a Black man, white man, Hispanic man, Asian man, all the same, correct?
Correct.
However, the disparity is in the economic inequality and in the access to medical care. So that's where the numbers are being more impacted. Is that correct?
Absolutely. And this is our mission in public health, to address these inequalities. So, hey, join us. We would love to have you.
Yes.
Talking to everybody.
Absolutely.
We would love to have you as part of our coalitions to address this. It's central.
Yes.
So, absolutely.
Thank you, Sarah.
So we have got some questions that are coming in. And so the first question is, what is the latest data on children and those with special needs and how they are being impacted? And so thank you, Dorothy, for that question. And so is there someone that will be able to talk to this a little bit?
Good morning, this is Jessie. we would have to run a report, I think, on our data, which we certainly could do, and circle back on that, because I don't know the statistics offhand.
Yes. And please
That's
know,
a good question.
yes, and please know, at the end of this, there's going to be more information to where you can get more questions answered and get more detailed questions. We're going to put that information up a little later at the end here. Sarah, I do want to ask you this other question here. Like, say, we were talking about the economic and racial, like, say that the race part does not have anything to do with the effects of COVID on the body. But I do have a question where I want to ask you, which, like, say, I want to talk about the vaccines now. Which COVID-19 vaccines are available in Sauk County residents right now?
Yeah, so which, do you mean the brand? Oh, you do have the brands up there. That was my question. Yeah, so we have both the Moderna, sorry, I didn't say that right. So, you know, when you see something on a screen, you pronounce it differently, or maybe it's just me, I need more coffee. Got it. Or the Pfizer. So we have both in our county. It depends on who you get the vaccination from. They either have one or the other. And while we're talking about this, and I know I handled the last question about racial and ethnic disparities, could you pull up again, would you be so kind, the slide, it's number 2 on who is getting the vaccine right now? Because I think that's an important part of the conversation too. And I know, Pastor, you had put up that slide, and then I went down my other path. And so I just want to tell everyone, you know, so far, racial and ethnic minorities in Sauk County are not getting vaccinated at the rates we would like to see. And you can pull up this data on who's getting vaccinated at any time by following this link here. And we're going to put it up on the screen again at the end, and we can put it in the chat box too. I'm not sure if with this you can just like click on it or not, and that's a long link. So wouldn't expect anyone to memorize that one. So we have in Sauk County right now, 16% of our population has received at least 1 dose of the vaccine, and you do need 2 doses for complete protection. but only 4% of our Native American residents have received the vaccine so far, only 3% of our Latino residents, and only 2% of our African American residents. So if this were equitable, we would see all of this be the same, 16, 16, 16, 16, right? Well, I do want to say, though, that some of this may be due to who is currently eligible for the vaccine. We're going to talk about this more, but frontline healthcare workers, EMS, firefighters, police officers, and then the age 65 and older group in Sauk County. And we do see that some of those groups have underrepresentation from these ethnic and minority groups. For example, I brought up before our Latino residents. We do not have that many older Latino residents in Sauk County. I think when we pulled up the data, it was only like 85 people in Sauk County identify as Latino and are 65 and older. So it's a small number. It's still not equitable, though, even given those small numbers. So, we're just thrilled to answer any of these questions that have to do with specific racial, ethnic kind of impact of COVID, and address any specific hesitancies, like why you might not want to get the vaccine. We definitely want to hear your concerns there so we can address them. Or is it difficult to get to the vaccination site? Or is it lack of information? So we'd love to hear from you. What's keeping you from getting the vaccine if you're currently eligible? And we'd love to work on that as a community.
Yeah, absolutely. And thank you for that. Thank you for those comments there, Sarah. And again, we're going to have information at the end of this where you can actually reach out to the Sauk County Public Health team to get that information, to get those contacts, and just get more detailed questions and get answers to more questions here. We're going to keep rolling here. I want to ask.
So right before that, I do want to say that we did have some comments coming in.
Yes.
And so I really appreciate Mary Ann for putting
Hallelujah.
her comment, and she said she would like to thank Sauk County for making it fairly easy for her to get her shot. And so,
yes,
since we're talking about this and moving into this space, just to be able to know that it is being done, it is a fairly easy process, and we have someone that is letting us know that as well.
Yes, so we're seeing that the process is working, y'all. And it's just we just have to actually just make that decision to go and get vaccinated. Jody, can we please ask you a question? What is the main benefits of being vaccinated?
Certainly. So one of the main benefits of being vaccinated is this gives us just another tool in our toolkit that we have to keep ourselves safe. So in addition to all of the things that we are encouraging all of our residents to do, such as hand washing, social distancing, and wearing your mask, the vaccine is just another tool that will help us all work to keep our community, our friends, and loved ones safe. So getting vaccinated is one way we can keep all of us healthy. We can support our healthcare workers, protect those that are vulnerable in our community, and get us all back on our feet. Like previous pandemics, if you think of like polio, the best way to get rid of COVID also is to be vaccinated against this virus. Experts do believe that 75% of our population will need to be vaccinated against COVID-19 to stop the spread of it.
Yes. So even if once vaccinated, can you still catch COVID?
So,
Jody?
Okay. Sorry, I'm just thinking here. So once you are vaccinated, you should not be able to catch it. But the reason that we still recommend mask wearing, social distancing, is because it hasn't been around long enough to ensure that you can't still give it to someone else that has not been vaccinated. So that's a big thing, is you could still be carrying the virus in your nose and in your mouth and give it to someone else, even though you yourself will not get sick with it since you have been vaccinated. Does that answer that question?
Yes.
Yeah. And if you do get it and you've been vaccinated, chances are you'll have a very mild case.
Yeah, okay. Kind of like the chicken. If you think of it like the chicken pox, you can get the chicken pox, and then chances are, of course, you wouldn't get it again, or even if you've got that vaccine, but if you do, it would be very, very mild.
Understood, and thank you for that. We want to welcome Ms. Tremonisha. Please introduce yourself there.
Thank you. Good morning, everyone. My name is Tremanisha Stewart, and I am the health officer for Sauk County. I'm the one that needed the furniture delivered because I've been here less than a month, but I'm very excited to be here and very excited to be the health officer for this county.
And thank you, Tremanisha. I also want to ask you a question here. I know it's kind of been touched on a little bit, but I just wanted to try to go a little bit more detail in it. And like, if when it comes to the vaccination process and the COVID-19 vaccine here in the Sauk County, what is the order for vaccines being distributed in Sauk County? Like, what is the pecking order? Who's getting it first?
Sure. So as Sarah has said, that the vaccine, both Moderna and Pfizer, are offered throughout the county. However, we're all vaccinating the same categories of people, the same eligible categories of people. So the first in that priority are healthcare workers. And then we use, after we've seen those, the next priority would be our first responders, so fire, EMS, police officers. And then we go into vaccinating those that are 65 and older. So the older you are, the more of the priority. So we put the 85-year-olds right under those first responders, and then 75 and 65. So that is the current eligibility. So you could fall into, you could be 65 and be a firefighter, you would still get the vaccine in that order. So that's what the priority is for right now.
Okay, and like when it comes to, like, say, teachers and students, are they, how far down the line are they?
So teachers are actually next, but since the vaccines aren't ready for children yet, so I believe one is for 18-year-olds and one is for 16-year-olds. So they're not eligible to be given to children or able to be given to children yet. But teachers definitely, because although children can get it, the teachers are the ones in the school system that can best protect the children from getting that. So we want the teachers to be vaccinated. They will be eligible on or after March 1st. So we already are, doing our due diligence as a county to plan for that and make sure that we get all of our teachers vaccinated that want to be vaccinated.
Thank you, Tremanisha.
And so as we continue on, Jesse, I have a question for you. And the question is exactly what underlying or pre-existing medical conditions make COVID-19 even more dangerous if exposed? And I know we touched a little bit on it, but if a person's DNA make them more susceptible to catching COVID-19?
That's a good question. So the people who are more likely to have a severe case at this point from the data that we've got seems like our older population and those who have a compromised immune system. Also people who have things like chronic kidney disease, or chronic lung problems, or heart disease, things like that. They're also seeing this in people who've had organ transplants because they may be on drugs that suppress their immune system, making them more susceptible. Also, they're seeing evidence of cases being more severe in those who are pregnant, smokers, and those who are obese. And also looking at some emerging data that's not been kind of finalized yet at those who have asthma, high blood pressure, dementia, liver disease, and some things like that may be contributing to more severe cases as well. But at this point, we really don't know a whole lot about DNA and how that may impact the severity of a case. So I think there'll be more to as we learn more about this virus.
Okay, and thank you for that answer there, Jesse. And just to kind of piggyback it, it's like say, like the pre-existing conditions, like you talk about cancer and all those other things. Like when you say autoimmune deficiencies, things like that, what does autoimmune mean?
Thank you. I should have clarified that. So there are certain illnesses that can cause where actually the body kind of attacks its own immune system, and that could be like thyroid problems, type 1 diabetes, things like that. And then there's medications that cause you to have a suppressed immune system for different things like rheumatoid arthritis treatments, and cancer treatments, things that are going to make your immune system not quite up to snuff because, and it creates that susceptibility or makes it easier for you to get sick. Does that answer your question?
And yes, and we just want to take a quick second again for those of y'all that just may have tuned in. This is Coffee and Tea with the Pastors, Pastors Antoine and Ramona Hallman of FaithWorks Ministries. And again, we just want to thank the Sauk County Public Health Department for the team for coming in and helping us out today answering these questions. And of course, just to piggyback Jesse's last statement, there was a great answer to that question. Just again, like when we're talking about COVID and we talk about the vaccination process, Jesse just kind of specified that it's going to be really important that you talk to your doctor about everything that you're taking. When you go to get the vaccine, you're going to need to talk and say, hey, these are the medications I'm on, and that way you're better protected so there's no reactions. And that's awesome.
Yes, and of course, as we continue, we have had some questions coming in, and this is really this open platform to be able to ask those questions, and you can definitely enter them into the chat. We did receive questions, so thank y'all for sending in questions ahead of time on some of them, but definitely throughout the conversation, if a question sparked, please make sure to just drop it in the chat.
Absolutely, absolutely.
So,
and no question is a dumb question. We want to get the truth out to you. We want to get these questions answered. So please ask.
yes, because it is all about that, getting that information.
Yes.
Because you have to have wisdom to be able to make the right decision for what we need for ourselves and what needs to take place for our family.
Hallelujah.
So so I do have a question that was sent in, and Jesse, maybe you can answer this one here. Where did COVID-19 originate? How is and what is making the virus mutate into different strands? Like they have the UK, South African, like these different strands. What is going on with that?
That's a great question. So I think we all probably remember a year ago when this was emerging. The first initial cases were seen in Wuhan, China. But and this is common for viruses to change or mutate, which creates a variant, which basically, and I'm sorry, my dog is barking.
That's okay. That's all right.
He couldn't do that when I was muted.
He wants to answer the question with you.
Yeah, he probably does. He thinks he's pretty smart. But so we expect these changes with any virus. That's like why we see different flu vaccines. That's why it changes every year, because the virus changes. So scientists and health professionals expect there to be a change. Basically, I wanted to just dive in a little bit about what happens and what this means. So basically, once the virus enters your system, it's going to replicate or make copies of itself in hopes it can really do some damage and infect you and make you sick. Well, as that changes and it's making copies of itself, sometimes it can be a little different. It can be when it replicates, there could be a little glitch in the system, if you will. And sometimes that doesn't amount to a hill of beans, but sometimes those changes can be significant and it replicates like that. And there we have a new strain or a variant from that mutation. So kind of what happens, and then why we see these new emerging things. So the changes that we've seen with the UK and Brazil and South Africa, they have those changes that we've seen with that have been sustainable for this virus. So that's why we're seeing new things. So at this point, though, the good news is that it looks like the vaccine is covering that pretty well. More studies need to happen. Again, everything is just so new that we're learning as we go, building the plane as we're flying it, as we've been saying. But, that is why we think that social distancing and the hand washing and the mask wearing is ever so important now with seeing these new strains as close as Dane County for us who live in Sauk County. Yesterday, we received an article about that. So I hope that makes that a little more understandable. I know for me, it's kind of hard to wrap my head around that, but that's just going back to the basics with the hand washing and the masks and social distancing, until we learn more about how these variants are going to affect us.
And thank you for going in depth on that, Jesse. I kind of want to piggyback that with another, or just an analogy or another question. Okay, like say for instance, like with the UK, the South African and Brazilian variants, right? Is it something they're doing in those regions that make it like? Is it something in their water? Is it something in their air that's like when you, like you say, when the virus goes into their body and it replicates itself, and then that glitch comes in? Is it something? Is it some element that would represent that glitch that they're doing? You know what I mean? Like, is it the water? Is it the air? Is it, you know, like say if one region likes, if everybody in the region ate pineapple or something, you know, as an example, with you know what I mean?
You know, at this point, I don't think so. I mean, and that may be something that we learn down the road, you know, that there are things that made us more susceptible or less susceptible to that. But I really think it's just viruses are kind of smart.
Okay. Yes.
Changes and go, oh, wow, that, you know, this works. I can make this person more sick, and it benefits the virus to do that. If it doesn't, that change that it makes will just kind of peter out, and it'll never, you know, nothing will come of it. But, you know, so to answer your question, I don't think so, but maybe we'll learn down the road that maybe there was some environmental factor or dietary factor or something like that that is making, you know, people more or less susceptible to this strain or that strain. But it's certainly nothing anybody's doing that, you know, they would be any, you know, have any awareness of. So.
And thank you for that clarification there, just because where I was going with that, I was thinking to myself, like, so here in the United States, can we maybe possibly looking at, like, say, a southeastern variant, a New England variant, a Wisconsin, you know what I mean? Can that kind of thing start happening here? That's where I was going with that.
You know, I think that it's entirely possible, you know, because it could have started, I mean, just like it started, you know, one started in South Africa, doesn't mean one couldn't start in, you know, Wisconsin. You know, I think it's entirely possible. You know, that's just where it's starting to make its changes, and that's where it emerged. Yeah, I think it's impossible that it could happen anywhere.
Understood.
Yes.
Thank you.
Thank you. And so with this, as we continue on, I do want to let the team know that we are getting some great comments to say that that the information, great information is coming out, Dorothy said, and then Jessica is saying, great program, thanks for answering questions. And so it's definitely something that is needed, again, for us to be able to get accurate information, be able to ask questions and get an understanding. And so we do have a few questions actually rolling in. And so this one here will go to Marianne, is asking, why is it important to have large number of people get vaccinated? What does herd immunity mean? So this, wow. Great question. And so who would like to go for that one?
I'd be happy to take that one. So that's a really good question. It kind of like goes back a little bit to the variant discussion we were just having. If the virus isn't going to benefit or has nowhere to go, it's going to peter out. So if it's trying to get into all these people that are vaccinated, it's really going to have nowhere to go. So the more people who are vaccinated, the better, you know. So then it really is just going to, I like to call it community immunity. The more we have vaccinated, the less places it has to thrive and do well and continue to infect our population. So I hope that answers the question there. If not, certainly post that in again or a clarification.
And thank you for that, Jesse. So the more people that has it, the less options the virus has to go, basically.
Exactly.
Yeah.
And so, y'all, thank y'all. Keep those questions coming in.
Keep them rolling. Keep them rolling.
Dorothy asked a question about, are there rural areas in and or near Sauk? And if so, what kind of outreach is being done to support those communities? So those rural areas, what is being done? Who would like to take a go at this one?
I can take that one. Sauk County is very rural. We have a lot of small outlying communities that we work together with our 3 healthcare partners in our county to cover with all of our services. There are a few things that we're doing with this vaccine and with the COVID outreach to reach all of those rural areas. We have been taking our testing sites to all the corners of our communities to make it easier for everyone in Sauk County to be tested. So we do have testing available 4 or 5 days a week in Sauk County in different locations. For vaccines, we do have a spot on our website when you sign up on our vaccine waiting list. We are asking if people have mobility issues. And if they check that they do, then we are meeting with our EMS partners and seeing as how we can go out to these people and take the vaccine to them. We've already had our Reedsburg ambulance has already gone out to a group home and done some vaccines on site for people that weren't able to come to us. So that is just one of the ways. We are also working with our ADRC to partner with them in providing rides for our residents that maybe can't get to us very easily for the vaccine, and the ADRC will provide rides for them. Maybe I'll let Sarah talk about another aspect that we are just starting with our Latino community. We're working with Sauk Prairie Healthcare, and we're kind of doing some brainstorming as to how to reach them. Sarah, I'll let you dive into that a little more.
Yes.
Sure. And we've actually met with other hospital systems as well, just knowing that we need to get all of our materials translated into Spanish, which we do. And Jody also has on your sign up form, when you sign up for our wait list, receive the vaccine through Sauk County Public Health. If you need translation services, you can get those. But we really value our relationship with our faith-based leaders like you all, like the pastors today, because we know that that's one great way of getting the word out to people. You're trusted leaders in the community, and you have communities that you are in touch with. So that's one way, that we'd like to continue this partnership through our churches as well. And that's another way that we're hoping to reach our Latino community. As you all saw, they're definitely more affected. We work very closely with the Ho-Chunk Nation as well.
Awesome.
Yeah, so we're really trying, to get at it from all different aspects.
Yeah.
Again, is it an access issue? It's hard for me to get there, or it's hard for me to get the information, having so much online. I hear Jody in the office together. She talks all day long to people who are 65 and older and are struggling with the technology of signing up online, incredible job with that. Yeah, but we're also still very open to ideas on ways that we can better outreach your circle. So let us know if you have ideas. In some communities, door-to-door outreach, it's handing out flyers. And of course, we don't have unlimited capacity at the health department, but we are looking at applying for grants that would enable us to do more in that regard. But really, for you all on the call, you all who are getting educated about these vaccines, either through this or if you could go out and talk to people about it, because you're a trusted person to your friends and your circle, that carries a lot of weight, because there's a lot of misinformation out there. But if you're a trusted person in your circle and you say, hey, I've looked at all this information, I've sorted through it, and these are the conclusions that I came to, of course, not trying to force anybody to do anything, but, or tell people what to do, but, this is the conclusion I came to. And these were the questions I had, and what questions do you have? I think that's really how community works. It's very organic, and we just talk to each other, and that's how information is passed. But again, if anyone has ideas on people we're not reaching, how we can do a better job, we're very open to hearing that feedback.
Yes, and of course, that's the purpose of this special coffee and tea. We're trying to reach the Native Americans, the African Americans, the Hispanics, and just let them know that it's okay. And so them hearing it from you makes a huge difference, and I believe and we pray that more people are actually going to decide to get signed up and take the vaccine here.
Yes, and then with that too, a lot of times, and I like to think about different things, an icebreaker to even get the conversation started with your family, with friends, is you can even do this as a replay to go through it, and then you have certain questions that has already been answered. You'll be getting resources in it. So you can even use resources like this as that icebreaker to have that conversation. And so thank y'all. Y'all still got questions rolling in.
Yes.
And so this one here is from Betty, and I think that
that'll be Jesse.
Jesse, this may be for you here. Betty asks, will COVID-19 vaccination only be a one-time, or is it like the flu every year?
Betty, that is an awesome question that I wish I had the answer to. At this point, we really just don't know what that's going to be like. My suspicion is it will be an annual thing, but we really just don't know yet. More studies will need to be done and more to come on. So stay tuned. We will definitely be presenting that information on our platforms as we get that. So
yes. And for the community and everyone that's listening, please know that, like Jesse just said, that we're kind of like learning as we go with this thing. So I know it's a lot of questions that may not be able to be answered right now. But again, at the end of this program, you're going to see the information to the Sauk County Public Health Department. And you'll be able to kind of just reach out to them and get more specific details. So y'all just be patient. But again, this is new to all of us, and we're all kind of going through this thing together. So it's just, we just have to do what is asked of us, with the masking and social distancing, and those simple things can make a difference here. But we're going to keep rolling with questions here. Yes, this is going to be a Tremanisha. Can I please ask you this question? As of today, what is the current availability of vaccines in Sauk County, and are they free?
Sure. So both vaccines are, again, in Sauk County. Most places will have vaccines available for you. You do have to go to our website and look at any place in the county that is closer to you that you would prefer to get your vaccine from. We do offer it here at the Sauk County Health Department. And what we do at the health department is we contact you when we have the appointment available for you to take the vaccine at the available time. Other agencies do it a little bit differently, but we're all vaccinating. We're all vaccinating the same categories of people. And the vaccines, no matter where you go in the county, is absolutely free. They say the best things in life are free, right? And we know that cost is definitely a barrier no matter who you are. So our government has made this vaccine absolutely free. If you have other barriers that prevent you from getting the vaccine and you want the vaccine, reach out to us. When everyone is saying that they want the feedback and that we're trying, that is not a joke. They're not placating you. We are absolutely committed to getting everyone vaccinated. And if there is something that is prohibiting you from getting the vaccine, we will do our very best to make sure that you get the vaccine. So we are very committed to making sure that everyone gets it. And we know that cost is a barrier, and that's just not the case for this vaccine.
And thank you for that. I have a piggyback question real fast. Are there like we're hearing in different places where say out-of-state residents are going to different places to get the vaccine and kind of taken from those local communities? Are there protections in place that would say someone from any a surrounding state trying to come to Sauk or a surrounding city trying to come to Sauk and get a vaccination? Do they have to wait in line, or what is any protection processes for that?
So every place is going to have a different sign-up mechanism or appointment mechanism. For instance, some places like primary care providers contact their patients. And so that's a protection, because if you're not accepting walk-ins, chances are you're not going to get someone from another state. For Sauk County Health Department, we really are relying on the honor system. We want to vaccinate everybody. We do want the priority to be, or the eligible population to be, those that work or live in Sauk County. And so when you register, we ask you a battery of questions to kind of feel out who's applying to get their vaccine or registering to get their vaccine. Unfortunately, sometimes there is desperation and people will try whatever it is that they can get their hands on. And that's not what we want to advocate. But at the end of the day, our main goal is to get everyone vaccinated. So we just ask that everyone be patient, whether it's your eligibility category isn't up yet, or you can't find some place that you prefer to go. We just ask that you be patient with us and kind of wait your turn, but we do understand, and we just want the same things you want. We want to vaccinate everyone, but it does take some time.
And thank you for that, Tremanisha. Thank you for clarity on that.
Yes, and again, we are getting just some great feedback from the community, and just saying to the team, thanks for answering the questions and keep up the great work that you're doing to support the Sauk County residents. And then Terry as well is saying, you know, thank you for all the great information. But we have a couple of other things that we want to call out. Just so y'all are aware, it is also in the post here that those that are eligible and live and work in Sauk County can sign up for the vaccine, that waiting list, and you just have to go to the website, and it's here in the thread. And then we'll also be sharing information after this call.
And that was Jesse that gave us that, correct?
Yes.
Thank you for that, Jesse.
Jody.
Jody, I'm sorry, Jody. Thank you, Jody.
Jody gave it to us to put up. And so I know that some more questions have come in. Let's see. Kimyana asks, if you had COVID but did not experience symptoms, if you take the vaccine and get COVID after, will you experience symptoms? Or does it make sense for someone who didn't have symptoms to get the vaccine?
I can take that one. So great question, first of all. We get this a lot. So if you had COVID but didn't have symptoms, you should still definitely get vaccinated, because again, as Jody alluded to earlier, we don't really know for sure how long your immunity will last from having the COVID illness. So if you're out of your isolation period and you're feeling well, you can get the COVID vaccine even if you had COVID, and it is recommended to do so. Now, the symptoms, whether or not you'll have symptoms, side effects, you may be asking from the vaccine. You know, we've heard totally just from stories we've heard from other people that if you've had COVID, sometimes your first shot gives you a few more side effects, but those are expected reactions, quite honestly. And then in others who have not had COVID before, it seems like the second dose creates a few more of those expected reactions. So, and I hope I'm getting at what you're asking for. And if not, please repost, and I would be glad to clarify. But, and then there are just these people who have no, the expected reaction. We're not seeing that at all with some people. So it's kind of hard to tell. Again, it's one of these things, and I know I keep saying that. We will learn more as things have been around a little bit longer. So it's going to be time will tell sort of a thing.
Yeah, and if I could jump in there too, what we do know about immunity after you've had COVID is that if you've had a very mild case, so if you didn't have symptoms or had just a few symptoms, your immunity is likely to be a lot shorter than someone with a very serious case. Their immunity tends to last longer. So we don't have a definitive answer, but it tends to be true.
So is it fair to say that, regardless of a person's belief, but the vaccines themselves, will they minimize hospitalization? That's the big thing. Eliminate, it's going to kind of stop death.
Okay. And so
stop death.
That's what we think. I mean, they're 95% effective.
That was kind of a bold question there. And so I know that we touched a little bit on this one, Sarah, but just what is the current number of people infected with COVID in Sauk County? The number of people hospitalized due to COVID in Sauk County, the number of deaths caused by COVID in Sauk County.
Thanks. Yeah. Oh, thank you so much for pulling that up. We anticipated this question. We are really happy to report that right now our numbers are way lower than they were. If you all remember, the surge that we experienced in November, we were seeing really high numbers. So our numbers are lower than before, which is really great news, and I think is an effect of working so hard to social distance and mask up and all of that, wash our hands a lot. But do be aware, as Jesse shared earlier, there are more transmissible, deadlier new variants, unfortunately, and we are seeing them, like Jesse said, the first variant of the UK variant was found in Dane County just like this week, and so be aware, don't let your guard down, keep doing all the great work that you're doing to stay safe and keep your family and community safe. Total numbers, we have had 5,214 confirmed cases. So we may have had more than this, but if you don't, get tested for coronavirus and you had it, then you wouldn't be included in these numbers. So these are cases that are confirmed by tests. Right now in Sauk County, we have 59 active cases, and this is data that was pulled as of yesterday.
Okay.
Last 14 days, our new case rate per 100,000 people in our population was 148 in Sauk County. So we are doing better than Wisconsin as a whole. They have 109 per 100,000 people. We've had 200 total hospitalizations in Sauk County. Right now, as of yesterday, we had 0 people currently hospitalized in Sauk County for COVID-19. However, as you all know, if you live around here, what we tend to do is transfer people to our Madison hospitals when they're sick with something more serious like this, because of the more intensive care they can receive. And for a while there, like that, our hospital beds were so full in this whole region, in the whole state, that we couldn't transfer people as they typically are transferred that need a higher level of care. We were unable to transfer those folks to Madison hospitals. Now we are again. So I think that helps to explain why we have 0 people right now in our Sauk County hospitals. Very sadly, we've seen 39 deaths in Sauk County due to COVID. We have an incredible data person who's not on the call today that updates our data very, very frequently, puts it out on Facebook Monday through Friday. We have a data hub where you can, if you're a data geek like me, you can really delve into all this stuff. So I put the web link up on the screen there, but you can also get to it. Again, I'm not sure if you can just click on that link from as a viewer. So you can get there from our regular Sauk County Public Health website that's been shared in the chat, and just look for the Sauk County data.
Yes,
Okay.
and we'll also share the links in the thread so that you can click on them.
And y'all, we want to thank the Sauk County Public Health Department here, but also just a reminder for those of you that tuned in late, we are pastors Antoine and Ramona Hallman of PAstoRs Ministries, and you are here with us for coffee and tea with the pastors. And we have very special guests here. We have Jody Molitor, Jesse Phelan, Sarah Jesse, and Tremonisha Stewart from the Sauk County Public Health Department answering your questions today. So we just thank God for them and their willingness to come on and really just get some truth out there. So we're just going to keep going with more questions. Please ask questions.
So we do have a few more questions, and I know we're getting close to a little time here, but it was a question that was asked, and I know that we talked about what was going on in Sauk County when it came to COVID, and I just want to make sure that we touch bases on if there's any numbers out there of the residents that has been vaccinated in our area in Wisconsin. It's a question that was asked from Dorothy. To date, do we have these numbers?
I can take that one.
Okay.
So our website does have a link to where you can get statewide data and county data. So not only Sauk County, but counties throughout Wisconsin. As of yesterday, when I checked the data, we had a good portion of our eligible population vaccinated. So we currently rank number 17 in the state of having our population vaccinated. I am really excited about having our 65-year-old population, having them 50% receiving 1 dose, and the 7% of them have received their 2nd dose. Really want that other 50% of the 65-year-old population vaccinated, but we are really excited that they didn't seem to have that hesitancy that we were concerned about early on. So really excited about that. So it seems that our population, our county is, being vaccinated, but we are concerned about our certain other populations in our county that may not be as excited about getting vaccinated. And that just might be that their eligibility hasn't come up yet. So we'll be keeping an eye on that. Again, we want that feedback as to why there might be hesitancy or any populations you feel we're not reaching or areas we're not reaching. But we are on a really good pace of getting our entire county vaccinated, those that want it.
Okay, and so like if a resident of Sauk County went to the Sauk County website, they can actually go and see like kind of like their place in line almost?
Like
their group or their category?
Like you can see ages and you can see races.
Okay.
Of those that were vaccinated in the county.
Okay.
Okay, so that was vaccinated, and then I can see when it's my
when my turn is coming, so to speak.
Oh, when your eligibility is there,
yeah.
there is another slide or another page on the website, not that exact one. But I guess we can send links to specific places where you can get the information versus vaccines, availability, vaccination, because they're on different pages, but it's all available if you navigate our website.
Understood.
Okay. I would like to share some really great information on the vaccines, Wisconsin-wide also, because I know that question kind of covered that. So really exciting. As of yesterday, Wisconsin has given 1 million doses of the vaccine to our residents. So that's a great number. Considering at the beginning of this, we were way down on the list. So we have really worked hard to bring our numbers up. Also, as of yesterday, we have had 250,000 residents complete both doses of the vaccine. And so we have had 40% of Wisconsinites 65 and older have received at least one dose. So those are some really great numbers. And we just want to remind people to, keep sharing this information, keep signing up where you can to get vaccinated.
And thank you, Jody. Wow, thank you.
And so I know that as we get ready to wrap up, we have to answer these questions here because I know they put them in. And as we're talking about the vaccination, it's two things that I know we have to be able to talk to that can get people, get them the information they need. So there was a question that asked, are COVID tests still free? So are they free? Do I have to go pay for it? Going somewhere and they say you need to pay? Talk to us about this.
I can take that one. Our Sauk County sites that we have, if you look at our testing site locator ones that we have set up, which are in Baraboo, the EMS department at Circus World Museum, Merrimack Fire, Spring Green Fire and EMS, Reedsburg Ambulance, and I am forgetting, Sauk Prairie Healthcare at Wellspring. Those tests are all free. There could be a cost if you go to your healthcare provider. You'd have to check with your health plan and your provider to see. There could be a charge for those, but ours are free, and those will continue, I believe, until the end of March, hopefully longer.
Okay.
Awesome. Thank you.
And then the next question that was asked, and I will see who would like to take this one. Are the vaccination, is it mandatory or is it voluntary?
I can take that one too, sorry. They are voluntary at this point in time. I don't know if that will ever change, but right now it is up to you.
It is up to the people. Okay.
Thank y'all. And keep those questions coming in, y'all. Keep those questions coming in. We thank y'all so much.
I have a question. It says, Dorothy says, this is the last question for her. If you have other questions, this is what this great team is here for. So
yes.
The question is, since some people are hesitant, is this the same for those in nursing homes and or other senior facilities? So,
As far as whether or not it would be mandatory?
Is it, okay, Dorothy, I think it probably when your question popped up, so if you can give us a little bit more information of where your question is stemming from, because I think we covered a couple of topics right before.
I'm gonna assume that that's what you mean, Dorothy. And they would still have to get permission from the patient or the family if there's a situation of, maybe some healthcare power of attorney that's activated. They would still need to get permission.
Okay.
Can I share just one really, I think, interesting tidbit of information about this group also? So,
Absolutely, please.
the nursing home residents were one of the first people, that we really worked hard to vaccinate. And a really heartwarming aspect that we're seeing from this is that their rates of death due to COVID are really going down now. So the vaccine is working, especially in this most vulnerable population. And so that's one of those things where those are the stats that we love to see, that what we're doing is really working and really giving us the effect that we want to see.
Wow, and thank God for that.
Yes.
Thank you, Jody. Let's see, I have a question for Sarah. What are the long-term effects and short-term effects of COVID on the body and the mind?
What a question. Yeah. So COVID to me is so scary because you don't know what you're going to get. You really don't. And we've talked a little bit about how some people, with pre-existing conditions or older people are more likely to have a more serious case. But I've young people that have a serious case as well. And then other people no symptoms or very mild symptoms. So many people can have no symptoms or mild symptoms. And then some of those short-term impact symptoms that we generally talk about with COVID, and Jody covered those right at the beginning: shortness of breath and cough and tiredness, aches, fever, could be possible, loss of taste and smell. But then some people severe cases, and their short-term impacts might include breathing failure. That's scary. Confusion or other problems with thinking, kidney or heart damage due to a lack of oxygen, or blood clots that could cause long-term problems. So if you have a really bad case of COVID, the greater that you then have a greater chance of having lots of your organs affected. And, most people get COVID and then return to normal health, but for some, their symptoms can last for weeks or even months after they've recovered, after they've recovered from that real emergency acute stage of being sick. People who aren't hospitalized can have a long-term symptoms or symptoms that come up late. Like even if you never visit your doctor, I know our deputy director talks about the story, so I feel comfortable sharing because I know she has in depth. She never saw a provider when she and her husband both came down with COVID, but she months later, still struggles with things like fatigue, walking up the stairs makes you short of breath, confusion, like people talk about brain fog. Other people have joint pain or chest pain that go on for a long time. And then because, COVID, again, it's just, to me, it's scary because it's weird. Like it can affect the nervous system, so a lot of people have a long-term effect of being depressed, of thinking clearly, and then we have so much stigma about depression. So if you're feeling depression, please, there is treatment available, there is hope, speak out. It's not the time to, shame yourself, because this is an effective illness, is that you can feel very depressed, very confused long-term. You might have, again, some of those long-term like muscle aches and headaches, and you might even have a fever that comes and goes. Like, it's just to me, that like this just takes such a different course depending on the individual. So that's why, I encourage the vaccine for people, because, if you take the vaccine, 95% protected is what the studies have shown at this point. And that's amazing. You're not going to get all these weird, hopefully long-term systems. You're not going to end up in the hospital. It just, it's such a new disease. And I just, the stories that I've heard of young people, really having a hard time and struggling long-term. I think I covered all those symptoms. The public health team, let me know if I left a few out. I think it depends on the person quite a bit.
And along with that, so since we talked about kind of those side effects when it comes to COVID-19, are there any known side effects to the vaccines?
I can cover that one because I feel so fortunate that I just got my second vaccine dose on Thursday as a public health frontline worker. So my arm is sore. It's like I can lift it over my head now, though. Okay, it was sore the day after, and that's probably the biggest, expected reaction that you'll have is you'll have a sore arm. If you haven't gotten vaccinated in a while, like that might freak you out, but for other things. But yeah, it's totally expected. The people I know who got the vaccine had that sore arm. What else can you expect? You might feel kind of cruddy. Like, don't tell my boss, Tremonisha, that I was not the sharpest tool in the shed yesterday when I went to work, but I was able to go to work. I just made a few, email mistakes, like emailing things to the wrong people. But thankfully, I'm in a job where, I have a desk job, so it doesn't require heavy machinery, that kind of thing. Like if you have that kind of job, you might need to take a little time off.
Yes.
Other things you could expect, let's see, feeling tired, feeling achy. I know with my first dose, I had a headache for like 3 days. It wasn't terrible. I never even for it. I'm one of those like all natural people as much as I can be. Yeah, but the really important things to know with all these like expected reactions is that it's a sign of your immune system kicking into gear.
Yes.
It's expected because it's not that you have come down with COVID, it's that your body is gearing up in like boot camp to fight COVID should it see it again, So we expect that. It's not a sign at all that the vaccine is unsafe. All of the studies that have been done on this vaccine say it is very safe. You might be thinking, well, this vaccine was developed super fast, and it was, but that's really the result of removing red tape that's usually there. Our government was able to put a lot of money into this. Governments around the world were able to as well. And then to really make the process way faster. But that doesn't mean that any of the safety steps were skipped. All the safety steps were in place. Every single study, every single phase, every trial was, tested, approved by scientists. This isn't the government that made the vaccine. These are researchers who dedicate their lives to this. And I feel these vaccines really are the result of decades of their research on this type of vaccine. So that's why they were able to do it so quickly. So, and I love answering this question too, because I'm one who needs research on everything. Like I did not vaccinate my kids until I read every single study. When I'm pregnant, it's like, I'm reading every single study on everything. I am investigating every single conspiracy.
Yes, absolutely.
How it feels. You don't want to, subject your precious baby, and I have 2 of them, to anything that is not necessary. So I looked at every single claim. I did, hours and hours of research because it's just how I have to be.
Yes, and that is what we're looking for in this time. It's like we want everyone to be able to get the information that they need to be able to do the research, so exactly what you need to do for you and your family.
And Sarah, I do want to piggyback to the previous question there, Sarah. I'm sorry. I do want to piggyback the previous question about the long-term and short-term effects of COVID on the body and the mind. Does the vaccine, can it minimize those effects?
That's what we're seeing, that you will not likely contract COVID at all. So you won't have those short or long-term effects.
Well, let's just say you've contracted COVID, you're in the healing process and you're going through those respiratory issues and things like that. Taking the vaccine, will it minimize the effect or decrease the length of time?
That's a great question. I don't know if anyone else on the team has an answer.
I think that's what we're thinking is going to happen. If somebody does get COVID after they've been vaccinated, though it's unlikely, especially in the short term, thinking is that if you do contract it, you will get far fewer symptoms and be much less likely to be hospitalized or ill. But again, that's data that's still emerging. So we just need to kind of keep an eye and see what happens here.
Yeah, and I haven't seen any research on what you're saying, Pastor, like if I'm still suffering from long-term effects of having COVID and I get the vaccine, will that help? I don't know.
And that's understandable. That's fair.
And so we have one more question because we're going to get ready to give you some resources here. But Kenyatta asks, if we have been sick and feeling some of the COVID symptoms and have been tested a couple of times for COVID and the flu, and the tests were negative, should we assume we have COVID? Who would like to answer that?
I'm happy to take that one again. No, I would not assume that you've had COVID. If the tests were negative, there's a lot of other illnesses that have similar symptoms, you know, common cold, that sort of thing. I would not assume without a positive test that you've had COVID. So I wouldn't be deterred from being tested again. If these symptoms come up again, I would definitely get tested to see what you're dealing with.
Thank you for that.
Thank you. So it has been great. And again, team, we have people that are just wanting to appreciate. Betty has said, thank you for answering the questions. Thank you for your time and sharing the information. And so we're just excited, and Tanisha has put up awesome topic and information. So this is just showing us that there's a need for it, that people are looking for this information, and then just wanting to be informed.
Yes, and that's what this is all about. No question is a dumb question. Just please ask those questions. But also here in a few short seconds here, we're going to give you some great resources to go to reach out to the Sauk County Public Health Department directly, so you can actually have conversations. Are y'all scheduling meetings?
Meetings for, I'm sorry.
Like if a person wanted to have a conversation where you just say, hey, I got this on my mind. Are you willing to do those kind of things? Great.
Oh, absolutely.
So we do have a slide here, and Sarah, where can people go for more information to stay up to date about the vaccine rollout?
Yeah, so we recommend first and foremost our Sauk County Public Health website. There is a lot of info on that site, y'all. So if you go to our county webpage at all, you know, the co.sauk.wi.us, you'll see scrolling across the top, kind of like we have scrolling across the bottom of the screen here. You'll see the COVID testing information and COVID vaccine sign up. So very easily you can just click there. So yeah, we have information on that site about where you can get tested and links to sign up for testing, all about vaccines. We have lots of frequently asked questions on our site, and also that sign up for the wait list for the vaccine if you are currently eligible. We have tons of resources for you all. You know, if you are struggling in any way, you know, I always speak to mental health because so many people suffer in silence, but it's been a hard year when you can't connect with people like you used to. You know, you might be affected economically. We have a ton of resources on our website. It's under a page called Resources for Individuals and Families, especially during this hard time. You know, there's lots of help out there for you, or be a resource for others who might need that. You can also follow us on Facebook and Instagram. We'd love to see you there. We recommend that people sign up for Nixle alerts. These are alerts that are sent out through your text, and there are a few different ways you can do that. You can just text your zip code to 888-777, or you can go through the registration process online there, and then you receive these alerts saying, hey, you know, this is where you can get tested this week, or, you know, alert, there's something else happening, or a change with the vaccination process, things like that. That is also available in Spanish, so please do share that with your Spanish-speaking friends. If you want to sign up for the state newsletters, they have a weekly newsletter about COVID-19 response and the vaccine rollout. So what we do in Sauk County is taken from the state. So they tell us what to do and we do it in terms of vaccine eligibility, et cetera. And then healthcare sites. So we've mentioned our healthcare providers a lot on this call. We have 3 major systems here in Sauk County: SSM Health, Sauk Prairie Healthcare, and Area Medical Center. And each one of them, as we've shared, does this slightly differently with their vaccine rollout. So we encourage you to visit their websites if you're a patient there, or if you live close to there. You don't have to be a patient. Everybody is accepting new patients to get the vaccine.
Okay. And what we want to do just real fast, y'all, just for the community here, we're gonna leave this slide up for just a few seconds. Hopefully y'all take some screenshots of it, just so you can have that information at hand. So like come Monday morning, you have the resources at hand to actually reach out and do what you need to do here.
Yes, and also on the page will be tagged with the Sauk County page. So if you go to their Facebook page and be able to follow, you'll be able to get this information as well.
Yes.
So screenshot it, but do know that the information that they're sharing, you'll be able to get to the pages to get to these links.
And of course, for those that may have tuned in a little bit late, you can actually just rewatch this at FW Ministries on Facebook Live there. So wow, this has been great.
This has
been awesome.
This has been awesome.
This has been awesome. Let's see, we can't thank y'all enough. Let's see, does anyone have any, I know we're gonna get ready to wrap up here, but does anyone have any closing comments or anything that we may have missed?
I just wanted to say you haven't missed anything at all. This has been such a fantastic time. And thank you from all of us so very much for giving us this wonderful platform to reach so many people out in our community and even further. We really love the feeling of being a leader in our community, and look forward to partnering with you guys at FaithWorks Ministries and anyone else in our community that is interested in joining us on our journey to get vaccine into everyone's arms. So thank you so very sincerely from all of us.
You're very welcome. And that's thank you for that, Jody, because we're definitely looking at you as the leaders in the community to give us what we need to make the sound decisions regarding the virus as well as the vaccine. We can't thank you enough. Did anyone else have anything? Okay. Well, just again, we want to thank y'all for joining us. Coffee and Tea with the Pastors. This is an awesome time. We want to, again, special thanks to Tremonisha Stewart, Jody Molitor, Jesse Phelan, and Sarah Jesse. Thank y'all so much thank y'all. God bless y'all.
God bless y'all.
And the community, we hope you got something great. And again, reach out and use the resources that are given to you. Use the resources that are given to you.
Yes. Make the decisions that's going to be best for you and your family.
Hallelujah.
God bless y'all, and y'all have an amazing weekend.